Sean Haughey, Minister number 52, 30 seconds to introduce.
That's me again, yep.
To ask the Minister for Health the way in which he plans to address the increase in Community Healthcare Organisation 9 in the number of overdue first assessments under the Disability Act 2005, and if he will make a statement on the matter. Minister, you will know that under the Disability Act 2005, an assessment of needs must begin no later than 3 months after receipt of the completed application, and the assessment of need should be completed within a further 3 months from the date which the assessment commenced.
Thank you, Deputy Minister.
I thank Deputy Sean Haughey for raising this very, very important issue in our area. I've been advised by the officials in the HSE that there is a delay in completing assessments of need in Dublin North City and County Community Healthcare Organisations due to the ongoing increasing number of referrals. So the numbers are going up. There are a growing number of factors driving this demand, namely the increasing child population growth in terms of children presenting with complex needs. Secondly, all applications and assessments to assess a need are dealt with in a strictly in order date of the application. Under the Disability Act, as you rightly said, 2005, an assessment need should begin no longer than 3 months after receipt of a completed application, and assessments should be completed within a further 3 months from the date on which the assessments commenced. There are plans in place, and I want to reassure Deputy Haida, to increase the staffing levels in therapy disciplines to support the assessment need process for children in CHO, Dublin North City and County. So that is something that we are pushing very strongly. Funding, for, as I mentioned earlier on, for the additional 100 therapy posts was secured as part of the budget 2019, and I want to thank Minister Simon Harris for his strong support on that, to improve the waiting times for assessment of need nationally. The HSE is committed to recruitment of these 100 therapy posts in the National Service Plan 2019, and the CHO Dublin North City and County were allocated 16 of those posts. So 16 of the posts were put in place. CHO North City and County are actively drawing from the existing panels with a view of having these posts filled by the end of 2019. The filling of these critical posts is designed to have a positive impact on the waiting times for the assessment need around the country. So the key issue, the 16 posts, will make an impression on it, but will happen over the next couple of months. Thank you, Carla.
Thank you, Minister. Deputy Haughey.
Well, I hope you're right, Minister. The issue of children overdue assessments under the Disability Act has been a running sore for some time now. Colleagues in the Dáil, including my party spokesperson on disability, Margaret Murphy O'Mahony, TD, have put sustained pressure on the government in relation to this. This has resulted in some improvements, especially in Cork and Kerry, where the numbers waiting at the start of 2018 were truly scandalous. However, in CHO 9, which covers north side of Dublin, we have seen the numbers go the opposite way. There were 442 overdue assessments in the second quarter of 2018, and that increased to 707 by the second quarter of this year, a huge increase of almost 60%. I'm sure the Minister would agree that to have so many children unable to receive their legal entitlement within the statutory timeframe is just wrong. Why has this happened, and what has been done to address it? And can you give an assurance that those posts will actually be filled? It's all very well intending to fill them, but can you give an assurance that those posts will be filled in order to improve this drastic situation?
Thank you, Deputy Minister.
Thank you, Deputy. Can I say, first of all, the number of new applications for assessment under the Act has risen steadily since it was enacted. Like 1,138 applications were received in 2007, whereas 5,839 applications were received in 2017. And during that time, a total of 43,521 completed applications were received by the HSE. And so the number of children aged 5 and over of school-going age has risen steadily as the percentage of all applications received. At the end of 2011, the figure stood at 26%. By the end of 2017, the figure was 51%. So there is an issue here with the level of recruitment. But in relation to your very important question, in relation to see the impact of the therapy posts, the funding for the posts has been allocated, and the HSE have told me they are committed to the recruitment of these posts and to rolling them out. All CHO areas have been advised to proceed with the recruitment of all the posts immediately, and all CHOs are activating the panels via the HBS and via S38 providers. Some of these posts have been allocated to Section 38 and Section 39 organisations. So it is anticipated that a recruitment of these posts will proceed quickly. For example, CHO 4 have 3 posts in place, and there's a target for all the posts to be filled by the end of 2019. But of course, absolutely, this is something we have to drive and push very strongly, and I will continue to do so.
Final comment, Deputy
Minister, in our constituency there is a 27-month waiting list for the early intervention team. In our constituency there is a 36 to 40-month waiting list for the school age disability team. You've had parents come to your advice clinic, I've had them come to my advice clinic. They are distraught trying to get services for their children who require these services. Minister, do you accept that disability services for children are in a crisis on the north side of Dublin? There's the occupational therapy situation. In CHO 9, the most recent figures we received show that 1,967 under 18s are waiting, with 881 of them waiting over a year. When a child has to wait a year or 2 years, can it really be called early intervention? Minister, you are aware of the situation. I appreciate the facts that you put forward, the reasons why there are so many people presenting for services, but there is a crisis. Parents are distraught. You are the Minister for Disabilities. This is your area, this is your constituency, and we really do need to address it.
Thank you. Final comment,
Can I say I agree that we have an issue, and it's essential that we deal with early intervention. There's no debate about that, and that is why in Dublin Bay, in our constituency, that is why we're putting has been allocated 16 posts in our particular area. And the answer to the question is, will that have a dent on the assessment needs yet? Is it acceptable these families waiting? I know a lot of them myself, and as you mentioned, we have them in our clinics regularly. But the bottom line is 16 posts have been allocated, and that will make a dent on those waiting lists. But can I ask to say one thing as well? When we're coming up to the estimates now over the next couple of months, I'll be looking for more money for therapy posts as well, and I would appreciate support, like last year when we were looking for. I'd appreciate the support of colleagues in Fianna Fáil as well, and I appreciate the support from Deputy Sean High, because it's essential that we accept the reality that we need support for these families and for these children with disabilities.
Thank you, Minister. Thank you, Deputy.